welcome to Perspectivas Latinas, a community service of CAN TV. I'm your host, Juan Carlos Hernandez. Our guests today are Dr. Edil Torres-Rivera and Dr. Hector Adames. Both are professors at the Chicago School of Professional Psychology. They are here to talk about some of the challenges Latinos face in mental health care. They are also here to talk about the Latino Behavioral Mental Health Conference this coming October 18th. Welcome.
Thank you.
Thank you.
Mm-hmm. Let's start off by talking about your experience. We'll start with Hector and learn why you came into this field and what's kept you in it.
Sure. If I could pick one word as to why I'm into this field is curiosity. I think I've always been a curious individual, a curious little boy, a curious adult now. And curiosity is the main reason why I think I came into mental health. And I was curious about what I was seeing around me. I grew up in a inner city in the East Coast and was always around family, friends who were migrating back to the Dominican Republic, where I was born and where I'm from, and back to the East Coast, to the States. I'm just curious about how people navigate different worlds, why my family did certain things and why other families didn't do what we did. And just curious about human behavior, mental processes, and how we're the same and how we're different. And what keeps me in it today is ironically the same thing that brought me in, which is immigrants, Latinos, and how unique, how beautiful our people are, and how resilient we are, and studying that.
And I guess how that the human develops in that environment of immigration and movement.
Absolutely.
Edil?
I guess in my experience is a little different. My experience is my grandmother used to be a spiritual healer. In Puerto Rico they call it espiritista, which is a combination of curandero and medium. Okay, and I was supposed to be online to be the next healer, you know. And when I was in the Army, the only job that I found out that you don't have to go to the field and play with the mosquitoes was to be a counselor because you have an office. But in that process, somebody sent me to school, and I found out that, you know, somehow I did have the gift to be able to connect with people and actually work people through healer techniques and so on. And now, many moons after, you know, what keep me in the field is the idea that, you know, there's a lot of problems that we have that are necessary, you know, connected to mental health, but it's not called mental health, you know. So the idea of mental health is very holistic for me.
Wow, that's interesting. Both experiences, the very Latino question of movement, especially here in the United States, and of traditional spiritual healing. Obviously, to people very rooted in our community. Now, talking about Latinos specifically here in the States, what kind of research have you done, and what are some of the things you found through your research? Hector?
Sure. My research is in a couple of different areas, but the linchpin that holds all the pieces together is multiculturalism and Latino psychology. So really understanding the experience of U.S. living Latinos or Latinos living in the United States. Very much interested in issues of racial identity, ethnic identity, which is basically how do I feel about who I am? How do I feel about and what do I think about how other people see me, right, as a brown man living in the United States? So how does that impact our mental health, our wellness, our way of navigating being in a foreign country? So very much interested in that. Also very much have done research on barriers to mental health. So what are the factors or what are the things that are impeding Latinos from seeking services, specifically mental health services?
Thank you.
I've been a little bit all over the place. I've been around just a little bit longer than Héctor. But I think that because I started pretty much with the whole multicultural movement, the idea that the theories and the practices of working with people of color were very different from the one that we usually learn in the school, and everything that we learned in the school, when we finished to practice, we had to unlearn it. So I was learning the things that didn't work. And in the last few years, from there I moved actually to the idea of looking at something that worked. I didn't know how to name it. So I went the route of chaos theory, which is a very interesting theory who come actually from science.
Right, mathematics.
It's
right?
mathematics, which I love, but by the same talking, was still something missing. And the last few years I've gone to the liberation psychology, which actually was born and practiced in Central America, and only came to this country about 10 years ago, but it was actually born and used in Central America for a long, long time. So my last few years I've been concentrating on liberation psychology with the idea of what oppression do to people and how people who do not gain access to mental health services eventually end up sick because they haven't been able to be served.
You both bring up very interesting topics. I want to return to what you said about identity and questions of identity and how Latinos and Latinas try to form that identity. And you said something interesting. In a foreign country, which many times, despite generational change, still feels very foreign to many Latinos. Tell me about some of what you found as far as Latinos and Latinas forming an identity and that process.
Yeah. So when we think of identity, it's a fancy word that us mental health folks use or counselors use, right?
Right.
But really, what identity is ¿quién soy? Who am I? Right? And which is a question that a lot of us have asked ourselves, and if we haven't, maybe we should.
Right.
But it's how we're answering that. How do we view ourselves, or how comfortable am I in my skin? And if I'm not comfortable, what do I do to become comfortable? So some folks become comfortable by being like the dominant culture, right? Some folks become comfortable by being let's call them rebels, being completely the opposite. So there's a whole spectrum of behaviors and ways of being that we cope with that question.
Okay.
And that has direct implication for mental health, for wellness, for even biological health.
Right.
Right.
Definitely. Edil, you said unlearning a lot of what you learned in school and adopting some ideas from Central America. You said liberation psychology, which I think is something similar to liberation theology.
It's have pieces of that.
Pieces of that.
Yeah.
Tell me a little more about that.
Well, it's actually because that going built into what Héctor just said. In the liberation psychology, there's something they're calling United States calling internalized racism, and I call it in reality colonial mentality, So pieces of what, people don't allow us to be who we are is the idea in which one culture is superior from the other, So the whole pieces of liberation psychology had to do with the idea in which people start to question and create some critical thinking and start to liberate themselves for the status quo, to be who they are and allow themselves who they are. That was born in Central America, so that ties into the whole idea of identity. So one is no foreigner for the other.
Absolutely.
Yeah. So it was it's a Filipino psychology who actually looked at stages of colonialism.
Right.
And one of the first stages of colonialism is to destroy whatever was established already there.
Wow.
Education, culture, and language.
Wow. And these are very deep topics, but let's bring it a little down to, it is part of the earth, but let's bring it to a level of what you see in the people that you've worked with and you've served. What are some of the major problems we see in the Latino communities around the country and here in Chicago in this dealing with oppression and dealing with forming an identity? Hector or Edil, whoever wants to start it off.
Sure. So, I mean, you know, we could go on for days talking about this.
Right.
You know, there's a lot of different mental health concerns, but one that I could that's very common, that's common today, and that folks probably hear a lot about it in the news or over the internet, is suicide amongst our Latina students and Latina girls, and what that is about, right? Why are we having that increase now?
Right.
Actually, the CDC report started tracking the suicide rates among Latinas in 2004, and what they have been, what they found is that as the years are, every time they collect this data, there seems to be a little increase. So today, in 2013, 15% of Latina adolescents have attempted to kill themselves, to harm themselves.
15%.
15%, or 1 out of 7,
One out of seven.
which is huge.
That's huge.
Absolutely. And 30% have at least had the thought. But having the thought doesn't necessarily mean I'm going to do it. And
Right.
and half of that number actually have attempted. So then the question is, well, what's going on, right? And I think it kind of ties back to what we were talking about, Edil, and it kind of ties back to identity, right? And acculturation, which we both touched upon briefly. Acculturation is how much am I going to, how much of the dominant values, how much of the dominant culture, how much of the dominant beliefs and customs am I going to adopt into the way that I live life, into my lived experience.
Right.
And
is there a disconnect there that's happening between that adopting those values and or seeing this huge?
They are. And some of the values are opposite. You know, for example, you know, we come from very collective, very familiar, familiar, yeah, okay, orientation, okay, and I think that the dominant culture, you know, kind of value and push individualism, you know. Right. So if you look at that, that's automatically day and night, okay. So that's one piece. The other piece is kind of like the idea of you know, value the things that you grow up with, you know. I mean, I like rice and beans and fried chicken, you know. You know what I mean? And
right.
But yes, you know, rice and beans is pretty much identified pretty much with one particular culture. So, you know, but not so much of hamburgers or right. hot dogs or French fries, you know. But you put a value in terms of what is more important than the other. That creates a variance between those two cultures. So if the thing I'm being asked to choose, you know, when I ask to choose, and sometimes when I'm asking, let's say for the adolescent, I'm being asked to choose between my values right. in terms of the values of my family and the values of the dominant culture. Right. So when I choose, it's, I mean, one time somebody asked me something about what it means to be Puerto Rican, you know, and it's kind of interesting because what it means to be Puerto Rican is that I can appreciate everything about my culture and everything that I've gone through, but I don't have to choose between my grandfather who was dark skinned and my father who's light skinned. I can combine both.
Right.
Okay. So I mean, so I think that's kind of tied to, you know, to the problems in which when you ask somebody to choose, that create depression. You know, and that depression is not attended, eventually ended into being numb, and numb eventually ended into being, you know, trying to kill yourself or really do it. Okay.
I like your word of you said combining, combination. And I think that's one of the areas for us to look at is that combination or that integration of the two cultures that is really difficult for adolescents to kind of engage in that integration process, or what we call in mental health biculturalism, being able to successfully swim in both different worlds, in the arroz con pollo world and in the French rice and hamburger world. And you know, when we talk about it, it seems like, oh, that's simple, but it's very complex because there's different not only literal language, but also behavioral language that's going on. There's different messages that we receive in different worlds, right? In the Latino world, when we're with our community, and then when we're in the mainstream community.
I think that the biggest problem we have, and we get that also with language. I mean, I wrote an article a few years ago in which I actually look at language and how people rank language. So what that means is the same thing with the culture. What the culture is, it's not a really okay to integrate per se. You have to choose one as being better than the other. Right. Which in reality does not happen. So imagine you put that pressure on a kid, and an adolescent who actually is going through changes and trying the integration. You don't get permission to integrate. Okay.
Right. And what have you found to be some of the remedies, or what can people within our communities, how can they respond to this difficulty that so many adolescents, or especially young Latinas are going through? How can we help them navigate that sea of change and thinking that they have to choose?
I think before we answer that, it's important for us to also consider what happens to the adolescent who cannot integrate both worlds or cannot swim in both worlds. And those, we call that process acculturation, right? So folks who are adopting more, they want to swim more in one particular area, right? And actually, what the research shows is that higher acculturation, in other words, adolescent Latinas who want to be more like the mainstream, highly acculturated, are at higher risk of, or more likely to have these suicidal thoughts, these thoughts of harming themselves. So actually becoming Americanized is actually detrimental.
Really?
Yeah.
Well, it's I guess it's such a disconnect from their family, from who they, how they saw themselves for their formative years.
Right. So then, to answer your question, one of the goals would be to help Latinas again be able to swim in both worlds, help them understand why perhaps their parents are unable to swim in the other world. Because the fact that there's a discrepancy between how they're acculturating, right? So adolescents acculturate really fast. They're in school, they're literally interacting with the mainstream culture. They go to school, they're learning the language. They want to be like their peers.
Right.
And then they're going home and they're asking their parents, well, why aren't you like my friend's parents? And there we have that boom, that clash. Right. And which creates a lot of the difficulties that we not that we're seeing now, that we've always been seeing.
I think this is kind of it's not a simple answer for it, because it's a very complex problem. But I think that the very first thing that I'm proposing sometimes is the idea to, you remember for a long time we talk about United States was a melting pot. And then we finally realized that it was not a melting pot, that it really was a tossed salad. Okay, so the idea to accept differences. So, but that certain differences imply the people, allow people to be the way they are, so it's a very systemic, a very intrinsic, and very deep kind of problem. My suggestion for parents and sometimes is just to be nosy, to be in the kid's life, because this is and Latino parents usually are, no matter what, but I think that's but then the dominant culture will go back and tell you, well, you have to let them, and it can sometimes create a distance, and so I think that's the idea of trying to be aware, to trying to be as much as possible, be vigilant, because adolescents go and get depressed no matter what anyhow. That's part of the transition.
There's a lot of changes going on.
So, but it's be there, be present, offer your help, be nosy, check things out from time to time.
Right. I'm curious about Latino adolescents and males. Our focus has been primarily on Latinas, and I think it's key and crucial because of the high suicide thought rate and then attempts. But how are Latino males navigating that, and what have you found about that?
Go ahead.
I don't have the numbers right on top of my head like I had for Latinas, but something that is alarming for our Latino males, is they're nowhere to be found in education. in higher ed. So while our Latina females were worrying about their safety,
Right.
for Latino males, our concern is more about their education and where is the pipeline leading them to. So they're practically invisible in colleges and in higher institution. So the problems, I mean, there's problems everywhere, but that's one of the ones where the literature and the research is saying this is an area of concern for our Latino males.
Yeah, the numbers of dropout among Latinos, continue to increase, which is very interesting because, I mean, we stopped talking about that a while ago, why, and we also know that then the gap, start to increase, and if you don't get some kind of education, you won't be able to get a decent job, period, But I think there's another interesting piece also is, and sometimes it's the connection in terms between, what happened when a Latino male, get a job. And, it's very hard for a kid who's come from a hard-working family to get a job to stop working to go to school.
Absolutely.
And I think that this is interesting because it's a double-edged sword, That's one thing. I think that, at least in my experience, we still have a little problem with the whole idea of substance abuse and what that means. You work hard, and sometimes you're trying to reward yourself by drinking hard.
Right.
So I think that that's pieces that we still have, some gap that we haven't looked. The research seems to be lacking from time to time because we always looking at the bad thing, and sometimes we need to look about how the trends look. And and I don't have an answer where they're going, but it's still a lack in the literature about what happened in terms of that relationship.
Go ahead.
I was just going to say, I love the fact that you highlighted that one of the main reasons why Latinos are not in school in higher ed, not because we're lazy, not because we're not smart, but because we're taking care of the family.
Yes.
Right, which is a big core value for Latinos, el familismo.
Right. It's a choice consciously made, right? For many Latinos, like, I need to take care of the people I love, right? It's.
I would question us all if it was a choice, because if there were some, I'm thinking, if there was more equity, then I think we would not choose to not go to school.
True. Yeah. Well put. Now, that's been part of our. This has been a very good conversation, but part of the reason why you're here is also to talk about this Latino Mental Health Conference that will be taking place in Cicero. The Chicago School of Professional Psychology is the sponsoring institution. Tell me about that, and who can come out, and what's the purpose of it?
It should be open for the community, period. The Center for Latino Mental Health, which is housed in the Department of Counseling in the Chicago School of Professional Psychology, has been doing. I think this is the 5th year anniversary, right?
Correct.
So it's been around for 5 years. So they usually trying to do something in which they involve the community, and they bring keynote speakers. They do workshops, and they're trying to engage people in what's going on with the mental health issues in the community per se. It's very community oriented, and if the idea was exactly that, to connect the community with the issues of mental health, for Latinos in particular, but it's open for anybody. I think that this year they're going to bring Marisa Gallardo Cooper. We first invited Dr. Redondo, but she have other engagements. So Marisa Gallardo Cooper, who actually have a PhD from cancer education from University of Florida, which is where I was. So
Small world.
From my department.
So you know her already?
Yeah, I know her, and she's very. She's also from Puerto Rico, so she's have a lot of expertise on working with families and in the community. And she will be the keynote speaker. So, the bottom line is, it's for everybody, show up, and enjoy, because it will be a nice conference.
Okay, and what are some of the topics that will be covered during these workshops, and that the keynote speaker will very likely address.
Sure. So one of the goals I know for this conference specifically, just because of the keynote speaker, is how to specifically work with Latinos and Latinas, U.S. Latinos and Latinas, when it comes to mental health concerns. So consejería, counseling concerns, how to work with the community, which kind of goes back to your other question, Juan Carlos. I don't know, I'm going back to it.
Go ahead, that's fine.
Of ¿qué podemos hacer? What is it that we could do?
Right.
And a lot of the times, you know, I was trained here in the United States, and it's like, okay, oh, you're Latino, you speak Spanish, okay, so you could treat this patient. And it's not that easy. I really wish it was, because then we would be helping so many other people. But we need specialized training to work with Latinos. Language is a part of that, but it's not the end. Right?
Right.
And I know in our department we have a concentration where we train master's level clinicians, counselors, to actually specifically work with the U.S. Latinos. And they receive specialized training on working on issues of racial identity, ethnic identity, acculturation, how to integrate all our Latino values, el familismo, respeto, dignidad, into the healing process, right? That goes above and beyond just language. In fact, you could speak Spanish and you could be Latino, and I personally believe that you could actually do harm if you don't have special skills than someone who has received the training to work with Latinos, but do not speak Spanish, excuse me.
So it's also, it's not just knowing a language, it's also having, like you said, skills, and I guess along with those skills, it's developing that those sensors, right? And how to know and understand and have a deep knowledge of how to connect with this person, and connect, I guess, to the greater community.
Absolutely, and how to decipher, right? Because we're all trained in the United States, and psychology is for the has been developed for the dominant culture. So how can we, right now, adopt some of those treatments to work with Latinos?
Right.
Although I personally believe that adaptation is a temporary fix. I really think we need more healing procedures, healing practices that's coming from the community. So by the community, for the community, but we're not there yet.
Well, that's the principle of liberation psychology, you know, which says everything has to come out, you don't have to reinvent the wheel. But it's just kind of interesting, because I think that sometimes it's more important to be bicultural than to be bilingual.
Okay. And we're going to have to end there. We're out of time. Thank you so much for this great conversation, and let's hope that this keeps developing for the Latino community.
Thanks for having us.
Thank you.
Perspectivas Latinas is a community service of CAN TV. If your nonprofit organization would like to work with CAN TV, call 312-738-1400 and ask for nonprofit services. Tune into Perspectivas Latinas for local issues and concerns every Thursday at 8:30 p.m. on CAN TV 21. I'm Juan Carlos Hernandez. Thank you for joining us.